Welcome back. Caring for a loved one who's living with memory loss can be challenging. It can be overwhelming. But there are options available to help lift some of the burden and bring a sense of normalcy. In today's Health Watch, Tirsa Smith shows you an agency that is helping families when they need it the most.
Life is all about stages. As we age, those stages can be tough to get through alone. What do you do when caring for a loved one with dementia or other cognitive declines accelerates?
Well, a lot of times it starts with a conversation with their provider, and they just discuss what their challenges are, and they're able to identify the needs, and then their physician will send us an order and what's called a referral, and then we're able to send a clinician out and determine if they truly would benefit and if they're appropriate for that level of home care.
Home health may be an option to help caregivers and patients get one-on-one attention to help them improve their quality of life.
Especially with right now with the holidays coming up, a lot of times families or patients may feel that isolation, and so sometimes it's just knowing that they have someone that they can trust to come in the home and help with those strategies. Sometimes it's just a breath of fresh air to know that they're not alone.
Tennova Home Health helps families navigate some of the uncertainty. Amber DeBoard is an occupational therapist who meets with clients daily.
We go in and we see how we can help people function. We adapt. So if they cannot reach that level of independence they had before, we adapt to make that possible. So we're really kind of we really promote life skills and how to do that more efficiently and more independently. And we collaborate with the patient and the family members and kind of do this together.
She walked me through some of the techniques they use to help families with daily obstacles.
So one of the really good examples is that we have a memory book that we work in collaboration with the patients and the family members to just kind of set them in the reality that they're in now. And then they can look back on that when we have any kind of agitation or behaviors or self-isolation. We can pull that out, and that kind of motivates them to be able to, work with their family members and with us.
While there is no cure for diseases like Alzheimer's or dementia, there are ways to increase the care and attention your loved one needs.
We don't focus on the losses as much as we do those retained abilities so that we can empower them and their caregivers as they progress through their disease process, but they don't have to do it alone.
For Health Watch, Tirsa Smith, WATE 6 on your side.
Tennova Home Health, by the way, isn't just for those with Alzheimer's or dementia, also for heart disease and wound care, physical therapy, and much more.